regards for testing, this I've got a question. You have to pay for the testing. We have to pay the employee while you're doing the screening when they're coming in and getting screened. Now, I think, and I'd be open to hear some comments too. Do we have to pay for the employee to get the test? And I think if the employer to get tested for COVID-19 to see if they're positive or negative, I think if the employer requires it, there's a good argument that it should be paid, and I would just go ahead and pay the employee for that. And we've actually been working with a few vendors that can come out to the workplace, do the testing there, and turn the result around pretty quickly as well. And obviously, you're going to have to keep in mind the issues that Rick was just talking about with, you know, safeguards while you're doing that testing as well. But generally, any of the pre-screening and testing should be considered time paid for the employees. Now, the EEOC has issued some guidance, and I'll walk through this pretty quickly. It's on the federal level. About screening employees for COVID-19 symptoms. They've said, yes, the employer can do that, can take employees' temperature, can require a viral test before allowing the employee to re-enter the workplace. But the EEOC has said this antibody test, the employer cannot require that from employees before they re-enter the workplace. The EEOC has said this is basically getting into medical examinations under the ADA, and it's not closely related, it's job related to the job and consistent with business necessity. So it's subject to change, but at this point, they're allowing people to test, their employers to test if the employees have COVID-19 or not, but not for antibodies. Now, turning to the CDC, and I've seen some questions coming in too, and I understand there are some contradictory guidance sometimes. It appears to be contradictory between the CDC, state, and local requirements. So I think it really depends on what jurisdiction you're working in and following. And you need to look at what your local jurisdiction is saying, because a lot of times these state is saying follow your local jurisdiction, the county, and then the county points you back to the CDC. So you have to walk through that analysis and see what your local requirements are, and then kind of go up the chain from there: city, county, state, and then federal requirements. So to be upfront with you, I hear your confusion. There's a lot of confusion, and it's tough to walk through this sometimes, but you know, you just get those websites together, walk through it, and we'd be happy to help anybody to go through that analysis if they need it. But on this slide, the CDC is setting out when the workers can return to work if they've tested positive for COVID-19. And it's different for employees who have been tested. They can return if they meet all three of those factors: no fever, the respiratory symptoms improved, and there's been 2 negative tests in a row at least 24 hours apart. And then if the employee has not been tested, there's no fever for 3 days, the respiratory symptoms improved, and at least 10 days have passed since the symptoms first appeared before they can return to work. On this slide, I'll just get through it pretty quickly. They've got some cleaning and disinfecting issue advice for essential workers. And here as well, you know, I wanted to point out on this slide too, and getting through it kind of quickly here towards the end, that it's clear, and I've seen a few employers here in Southern California get dinged on this issue. An employer cannot require a sick employee to prove a negative COVID test result or healthcare provider's note to return to work. You can't contingent an employee returning to work on that. So just keep that in mind. If you can follow this other guidance, but you can't require them to show up with a negative test. Now I'm going to skip through this quickly, and some of these different options when an employee can return to work if they've been exposed or have had COVID-19. And again, if there's no test, these factors have to be met. And then option 2, if there's a test, these 3 factors have to be met. And I've got the CDC's website listed here. Just pulled that again, updated that on June 30th to confirm that. So you can get that information here and follow that from the CDC.